Thank you again for sending in your questions. Keep them coming. So there's been some questions around treatment options, and I think this is going to have to be unpacked in several different minutes here, but I just wanted to touch on acute treatment. This is our rescue treatment for migraine, and a lot of people wonder, why is there variability in how it works for me versus somebody else? And this is probably a longer answer than a minute can have, but let's first talk about what acute treatment is meant to do. It is meant to stop your attack and get you back to function, ideally within 2 hours, ideally symptom-free. Now, depending on how frequent your migraine attacks are, if they're more episodic or chronic, this can have an influence on how well you respond to acute treatment. In addition, there is the timing of acute treatment, which can be really challenging because we know all acute treatments work better earlier, but as an attack goes on, it's harder to sort of bring it back down or get it back to zero with our acute treatments. So there are several different factors that can be at play here. Now, to make things even more challenging is that we don't have a one size fits all approach. So there are two specific medications that were built for migraine for acute treatment. One are Triptans, and the other group of medication are Gepants, or newer medications. We in Canada have 2 different Gepants for acute treatment. We have 7 different Triptans, and we don't have a good way of determining why one is best for you, your sister, your neighbor. So we do have to sort of go through them and try them. So there isn't, an easy, we've nailed it on the first approach. So it can take a lot of time and effort. And we know that takes a lot of effort on the person living with migraine navigating this. So join back in again. Please ask more questions and we'll come back to this topic because it's really important, especially if you have to advocate for your care and accessing good acute treatment.